Hello students, today I am going to tell you about appendicitis, that is inflammation of the appendix. Appendix is a small finger-like structure which is attached to the ileocecal valve. Because it empties into the colon insufficiently and its lumen is small, it is prone to becoming obstructed and is vulnerable to infection. अपेंडिसाइटिस बेटा क्या होती है, जो इलियसिकल वॉल्व के बिलो अटैच्ड होती है और इसका जो ल्यूमन होता है बहुत स्मॉल होता है. इसकी वजह से इसकी ऑब्स्ट्रक्शन के चांसेस और इन्फेक्शन कैच करने के चांसेस बहुत बढ़ जाते हैं. इन्फ्लामेशन हुई अपेंडिक्स को हम बोलते हैं अपेंडिसाइटिस. Okay, the obstructed appendix becomes inflamed and edematous and eventually fills with pus. It is the most common cause of acute inflammation in the right lower quadrant of the abdominal cavity and the most common cause of emergency abdominal surgery. Okay, understand, males are more affected more than females, teenagers more frequently than adults. The highest incidence is in those between the age of 10 and 30 years of age group. Okay, teenagers are more prone to infection and adults are more prone to infection of appendicitis. In this case, inflammation of appendix is there. I hope you will all understand the definition of appendicitis. Next, we will discuss clinical manifestation of appendix. First of all, lower right quadrant pain usually accompanied by low-grade fever, nausea, and sometimes vomiting is there. Patient feel vomiting and right quadrant pain. Very severe pain is present in the appendicitis patient. The pain is generally at Mcburney point. The Mcburney point located halfway between the umbilicus and the anterior spine of the ilium. Local tenderness with pressure and some rigidity of the lower portion of the right rectus muscles is also present. That is, when we touch the right quadrant of the patient, then there's too much pain. Patient feel too much pain is there. Next, Rovsing sign is present. That is, if we touch the left quadrant, but the pain feels in right quadrant of the patient. In the picture, you can see the Mcburney point, which is located between halfway of umbilicus and the anterior spine of the ilium. Okay, at this point, patient feel pain. This is most important thing. Students, you have to learn Mcburney point. This is the question which usually comes in the exams, that the pain, the site of pain in the appendicitis. This is Mcburney point. Okay students, next we will discuss diagnostic evaluation of the patient. In this, first of all, we will collect the history of the patient. We will take the data from the history of the patient, that is the personal history, whether patient is non-vegetarian or vegetarian. And then next we will check physical examination of the patient. We will check the site of the patient, that is where is the pain is there. Especially we will check Mcburney point. WBC count, we will check lab examination. WBC count, that is leukocyte count, is greater than 10,000 per millimeter square and neutrophil count greater than 75%. Urine analysis will be done, whether their urinary infection is there or not. We will check abdominal X-ray. We can take CT scan of the patient and ultrasonography of the patient. If the patient is female, then we will check the pregnancy of the patient. Pregnancy test should be done. And last but not the least, we will check the management of the appendicitis. The particular management for appendicitis is surgery. That is conventional surgery or laparoscopic surgery. Laparoscopic means we can use laparoscope. Is indicated if appendicitis is diagnosed and should be performed as soon as possible as to decrease risk of perforation. हमको क्या करना है बेटा, appendicitis को बहुत जल्दी रिमूव कर देना है. इमीडिएट एमरजेंसी सर्जरी करनी है ताकि जो अपेंडिक्स है वो फट ना जाए, परफोरेट ना हो जाए. इफ़ it perforates, then it will cause infection in the whole peritoneal cavity and that it become the risk and it is the fatal disease for the patient. That's why we have to do appendicitis immediately, to remove appendicitis immediately, and we have to perform appendectomy. The surgery of the appendicitis is called appendectomy. Okay guys, thanks for watching.